Hello, my name is Emily Morris and I watched the video about coverage. I believe a very important part of the Affordable Care Act is coverage for preventative care services. During the video there were positive and negative comments about each side of the issue. Some members rendered it the most important thing to reduce healthcare costs, and the others felt that it would not affect healthcare costs significantly. A study by the Centers for Disease Control found that only half of the U.S. adults receive recommended preventative care services such as mammography, cholesterol screenings, and colonoscopies. Smoking, lack of exercise account for nearly 50% of all premature deaths. The U.S. devotes healthcare resources to the diagnosis and treatment of chronic diseases, but very little to the preventative services for these diseases. The increase of clinical preventative services could save nearly 2 million lives every year and $3.7 billion annually. A survey conducted by the Kaiser Foundation found that 24 million Americans who will gain health coverage by 2019, 37% have gone more than 2 years without seeing a primary care physician, and 29% will have had no interaction with health care within the last year prior to obtaining coverage. These patients are going to need primary care providers, and they will now have access to coverage in health care. The ACA strongly emphasizes preventative care through the insurance reform. Increased reimbursement for primary care providers are also provided, along with education for preventative care services for these providers and incentives to provide primary care. The all marketplace plans and many other plans must cover the following list of preventative services without charging a copay or a co-insurance. Some of the preventative services covered are colonoscopies, cholesterol screenings, obesity screenings, vaccinations, type 2 diabetes screenings, and many more. This applies only when the services are under your network provider. 3 things I learned. I learned a lot about the Affordable Care Act. I wasn't very knowledgeable about it prior to this class, and I now know more, which will help me in my practice and understanding the changes that are coming. The second thing is the differentiation between legislation and regulation. I've never been a big fan of politics or the economy. I've now learned a lot about the economy and healthcare, and I've learned to respect it more as it will affect how I practice as a nurse practitioner. And the last topic is the weight that the nurse practitioner can have in the American healthcare system, and how the organizations such as the American Nurses Association join to fight against issues that may not have look at rights for nurses and how they can assist and help in this fight. Thank you, and I hope everyone had a good semester.